We all do it, but nobody wants to talk about it. Urination and defecation are the subject matter, and for the common words, you might say peeing and pooping. Bottom line is it's something to discuss with your healthcare provider, be it your primary care physician or your OBGYN or your urologist. If you are currently having problems with incontinence, it's important to realize that there are muscles that control those processes. It's pelvic floor muscles, and there's over 30 muscles just in that pelvic floor girdle that can be educated so that the myths can be dispelled surrounding incontinence. There's a link below that teaches you about the myths of incontinence, and I'm going to just briefly touch on them now. The first one is that incontinence is a normal process. It is not normal. It may very well be common, but it's not normal. Just because of your age or your gender or how many babies you had does not make you subject to incontinence. What you want to realize is, a 5-year-old who's still bedwetting is suffering from incontinence. If you are my age and you have stress or urge incontinence, whether you're running, jumping, sneezing, coughing, if you have incontinence and leakage, that's not normal. Or if you're older and you're wearing some sort of diaper or liner, that's not normal. So that's the first myth, common but not normal. The second thing is that you can go on the internet or a variety of other sources in this information-rich technology age, and they will spew out good ideas for you to use. But it's not a one-size-fits-all treatment. It is very specific, so you need to be able to train those muscles that some have to be stretched, some have to be strengthened, some have to be more relaxed. So it's important that you look at what it is you're trying to accomplish and realize that it's a very customized therapy that you should be seeking. Third of all, it's not a therapy that necessarily has a cost associated to it. Most of the time, pelvic floor therapy is covered by insurance. For example, Medicare covers it. It's not also a very frequent therapy. Most of the time you're seen once a week, maybe 5 to 6 weeks, and you can cure that incontinence in that amount of time. There's a new product out there called Emsilo, and it's a chair that has like a stem in it, and you go in and you sit, and they're charging $300 cash for 30 minutes of treatment, and you go 4 or 5 times for this treatment. And while it might target some of those muscles, it is not specific, and once you stop going, you will have that problem back again. So that's really not your best way to handle that. You want to get kind of lifelong changed patterns, exercises to learn, things that you can do, so that once you leave, for example, a physical therapy program, you continue to do those types of exercises and you employ those techniques so that your incontinence doesn't come back. So I would encourage you to kind of research that, because most insurances do cover pelvic floor physical therapy under your physical therapy benefit. Finally, medications and surgery are not the answer to some of these problems. While there are cases where surgical correction is needed, most of the time, if you work with those muscles, you can strengthen them, you can stretch them, you can relax them, you can do whatever is needed to be done. Sometimes it's alternating muscles, they work in tandem, and you can then control those functions as a function of learning those muscle groups. So usually medication and surgery, again, are not an answer. That's a very common myth. Finally, I'd like to encourage you that when you decide to go to a treatment of some sort for incontinence, find a skilled physical therapy provider. Our providers here at Western Berks, we've been running pelvic floor therapy for over 15 years. They are either trained by SOA or Herman and Wallace in their courses. They're certified. They have experience. They've taken the courses. They've worked with hundreds and hundreds and hundreds of patients with very tremendous success stories, not only in incontinence, like urinary and fecal incontinence, but also in sexual dysfunction or in retraining muscles post-surgical for a prostate cancer or for a hysterectomy. So that also involves all those surrounding musculature to that pelvic floor. I'd encourage you, if you have issues surrounding urinary incontinence or fecal incontinence, first of all, to do some research, but second of all, to come here. Seek treatment. There's a link below. It dispels the myths surrounding incontinence. There's a lot of them, but there's really no reason to have this common problem that is not normal.